Good morning. For those of you whom I have not had the pleasure of meeting, my name is Jim Tucker, and I am the President and CEO of CommCare Management Corporation. It's hard to believe, just over 6 weeks ago, our communities and facilities were confronted with the coronavirus for the very first time. It seems like years ago. Given its impact, I want to update each of you on where we are as a company and where we stand in dealing with the pandemic. But before I do, I want to thank you and acknowledge your commitment to the residents who are entrusted in our care. You are the front line of this fight, and being there each day to shoulder your part is nothing short of heroic. For those of you who are in buildings where the virus has manifested itself, you know firsthand the cruelty of this disease. I can speak personally to the anxieties and fears of the families of our patients who have contracted or died from the virus. My father was a very ill patient at Greenbrier, where for months he received extraordinary care. Then he contracted the virus on April 4th and died Easter Sunday, April 12th. But not before he received the most loving and compassionate care my family has ever experienced. We will forever be grateful to the entire staff at Greenbrier. For those of you in facilities where the virus has not been directly felt yet, I urge you to stay vigilant, and I urge all of you to strenuously observe all infection control protocols in the facility, in public, and at home. Lives literally depend on it. I'm certain you have heard or read that many healthcare providers are in financial trouble or struggling to manage losses associated with the pandemic. I want to assure you that CommCare Corporation today is as financially strong as it has ever been. Being a geographically diverse, multi-home provider has greatly cushioned the financial impact of the virus, and we have more than sufficient reserves to carry us through this calamity. Your job is safe. In fact, each of our facilities is in need of additional staff in various roles. If you know of any health professional that has been laid off or furloughed, please ask them to come see your administrator. We're hiring and always looking for good people. As the curve has begun to flatten in the hardest hit areas, the governor and others are beginning to talk about reopening the economy. I'm not sure when things will open up or exactly what they will look like, but I can assure you one thing. We will not be returning to how it used to be. In fact, one of the most important things I have been focused on is what will the short and long-term future look like for the nursing home industry and CommCare in particular. In the short run, elective surgery, hospital referrals will resume. Medicaid admissions, which have slowed because of labor and approval issues at the state, will begin to pick up again. And in the long term, opportunities to expand our business into other care alternatives for our patients, like our own Dignity Care Managed Care Plan, will open our facilities to new markets and patients. The future will be different, but it holds great promise. I keep on my desk, right by my phone, the mission statement of CommCare. I look at it every day to remind me why I'm here. If you haven't ever read it, it says, "Our mission is to be an innovative leader in the development and delivery of quality healthcare services, and to be committed to a learning environment that attracts and develops dedicated caregivers." I give you my word that I and every member of the leadership team will continue to work tirelessly to support each of you working at the bedside, making sure you have what you need to provide the highest quality level of care and help fulfill our corporate mission. But today and tomorrow and the next day and the future depends largely on you. Operations within the building have changed and will continue to change to prevent the spread of COVID-19. More than ever, I ask that you be flexible and work as a team. None of what we strive to accomplish can happen without the quality care you and your colleagues provide each and every day. As I close, let me thank you again for all you do individually and as a team. And let me say how fortunate I feel to be just a small part of such a tremendous organization. As Mr. Stacy, our board chairman, always says, we are the caring company. I will continue to pray for your health and safety and the health and safety of your families through these challenging times. God bless all of you, and thank you again for all you do.